and thank you for joining us for Together San Diego. I'm Paola Hernandez-Jayo with the San Diego Union-Tribune. San Ysidro Health has been providing comprehensive health services across San Diego County for 55 years. Our guest today is Ana Melgoza, Vice President of External Affairs at San Ysidro Health. She's going to tell us about the organization's rich history and the pivotal role San Ysidro Health plays in fostering civic engagement and addressing health disparities in under-resourced communities. Hello, Ana. Bienvenida. Welcome. Thank you for joining us on the show.
Thank you for having me, Paola. Very excited to share just the wonderful community resource that is San Ysidro Health.
Congratulations on 55 years of serving the community. Tell us about the start of San Ysidro Health, which is 55 years in the making.
That's correct. So we were founded by 7 mothers looking for care for their children when the only doctor in San Ysidro was relocating to Chula Vista. Now, by today's standards, that doesn't mean much. But back then, when there wasn't a lot of public transportation, and especially when, as we know, a lot of women weren't driving, that was a huge barrier to access care. So these 7 moms with very limited education and English had the fervor and also the resilience to come together and organize and create a first clinic in a little white house that we affectionately call La Casita. And there it was staffed by 2 volunteer nurses and 3 volunteer doctors. And so, as you can see, very, very basic care at the time. Well, fast forward, now we're able to honor their legacy of taking care of children. And today we have 50 program sites located throughout San Diego County, from the border all the way to East Rural Campo, Julian, Alpine, all of South San Diego, Central San Diego, and up to Escondido and Vista. And we're very proud of the fact that we have 3,000 staff members that compassionately care for the 161,000 lives in our care, daily providing essential medical, dental, and behavioral health services for all of our family members, from pediatric to geriatric.
You mentioned the different clinics that you have and that you're located throughout the county. You also mentioned the mission that you have. You also have a big focus on affordable and accessible care provided through San Ysidro Health. Tell us about this Service for All.
Absolutely. So what we offer is affordable health care in many communities where access to care is limited. What we do is we work predominantly with families that are low-wage, hardworking families that are able to qualify for Medi-Cal. About 85% of our population, the families that we serve, live at 200% below the federal poverty level. What that means is that we have a family of 4 making about $62,000 a year. And as we know, access to healthcare can be costly, especially when families are cost burdened with housing and groceries and utilities. What we do is we provide many of our services that are covered by Medi-Cal. And so we're able to offer medical, dental, behavioral health at nominal copays for our families. But what we also do is we also work with our San Diego program for all-inclusive care for the elderly participants. And that's a special program that through Medicare and Medi-Cal, people who are eligible over 55 years of age that qualify for nursing care are able to get day-long care from us, in addition to many other services, including specialty care, dental care, and many more, therapy, behavioral health therapy, physical therapy, occupational therapy. This is important because, as we know, when we age, we are also aging with many chronic illnesses. And so in order for us to keep our community members safe with our families, we offer daycare activities where we go and we pick up their loved ones, and we have them with us throughout the day, offering them their meals. And that's really a great break for the caregivers. Many times it falls predominantly on a mom that's living at home taking care of her parents as well as her children. That's something that we call the sandwich generation. And so we're able to offer that respite care and also allow them to work if they want to, or just take a break for the day.
Is this the PACE program, the one that you described for seniors and that picks them up and can also take care of them?
Absolutely. SD PACE stands for San Diego Program for All Inclusive Care for the Elderly. We are actually the fourth largest PACE in the nation, the second largest in the state, and the largest in the county. We have about 3,000 participants enrolled, and we offer comprehensive care for our participants so that the family can have one less thing to worry about when it comes to caring for their loved one.
That is wonderful. I have seen the PACE. They're like little minivans and cars around town. I have seen them, and it was nice to learn more about the program as I was preparing for this interview. You also, through San Ysidro Health, you have civic participation, and that's important, and it's tied to health and the quality of life for the communities and the research that you do. What is the My Vote, My Health initiative?
Well, that's a wonderful question, especially given that we're near the election. So back in 2000, we were actually back in the 2020 election, we were asked by a sister organization called Altamed, based in Los Angeles, to partner with them in a civic engagement program called My Vote, My Health, where we, as trusted messengers, especially in communities of color, were encouraging our patients to vote. Knowing that we are a 501c3, we weren't telling them who to vote for. We were telling them to please vote and the importance of voting and vocalizing their needs. The most important part of that was who we target is known as low propensity voters. These are people that get automatically registered to vote when they go to the DMV. They sign up. However, they don't practice their right to vote. And so what we did is we explained how simple it is to vote. We also explained the importance of voting, especially if there's a policy that they felt they weren't in agreement with. And what we have found is that when someone votes 3 times, they switch from low propensity to high propensity. And so what we find is that elected stakeholders, start to really take an interest in families that vote, because now they know that they're seen and now they know that they have to work for their vote. So in 2020, after we did that campaign, we found that we were able to increase 13% of voters to participate. And that was just almost miraculous. In campaigns that work to increase that spend a lot of money doing so through our trusted messenger model, which was by putting posters up in our exam rooms, having it in our digital signage in our waiting rooms, prepping our clinicians to just ask, have you voted already? And explaining to them how easy it is to vote. It really encouraged people. In fact, at the end of the research and the survey, when people were asked, you had never voted before, why did you vote this time? They said, oh, because San Ysidro Health asked me to.
Oh,
And so
congratulations.
oh yeah, it's just beautiful. And what we're finding this election is that we have people that really want to know how to vote and how easy it is to vote. And so we just had a conversation with a staff member who was excited because this was the first election they were going to vote in. They just became a naturalized citizen. And so they were monolingual, Spanish speaking. And so we actually sat down, showed them on her smartphone how to access and find out if she was registered to vote. And then she was able then to get her mail-in ballot. And she was so proud. He took a picture of herself putting that ballot in the mail. So it just goes to show that through just that connection and that trusted messenger connection, people really do want to participate in this democracy. It's just they've never been asked to by someone that they trust.
Thank you. Thank you very much, Anna, for sharing this information. I also, as you mentioned earlier in the interview, did want to share your website, health.org, and then also the telephone number if the public has questions or would like to call 619-662-4100. And I know you also have, as you mentioned earlier, information and services available also in Spanish. And also that San Ysidro Health, as you mentioned, you have multiple clinics and healthcare centers. They're not just located in the area of San Ysidro. You are now in multiple locations throughout the county.
Yeah, and that's really important to know. What we do as a safety net nonprofit healthcare provider, we really want to prevent any kind of ER episodic care. And we know that the way that happens is through a relationship with your primary care provider, with your dentist, or with your behavioral health specialist. And so our goal is to really create these long-term relationships so we're able to partner and manage care together to prevent any kind of that ER visit so that we can leave those ER visits to life-threatening emergencies and not so much for primary care. So we do have, in addition to our medical, dental, behavioral health, we also have urgent care. And so we're able to offer care after hours or on the weekends as well.
Wonderful. Thank you for sharing that information with us. Anna, thank you for being on the show with us today. Always nice to see you. Thank you to you and your team, the doctors, all the staff that work there, and the nurses, the caregivers, all of the support staff that you have at San Ysidro Health that work to make our community a better place. Thank you all for watching today as well. Again, for more information, you can go to syhealth.org or call the telephone number 619-662-4100. And if you would like to watch more of these episodes of Together San Diego, you can go to Union-Tribune.com/Together San Diego. Anna, thank you so much for being on the show today. Have a wonderful rest of your day.
You too. Take care. And
You
stay
too.
healthy.
Thank you. Likewise. And thank you all for watching today. Have a wonderful day.
Bye-bye.
San Diegans accomplish great things every day. We care about our neighbors and our community. We are proud of our diversity. We are resilient. We hold our leaders accountable. We live in one of the most dynamic cities in America, the San Diego Union-Tribune, telling San Diego's story for more than 150 years.